What happens when the very food that's supposed to nourish you becomes your enemy? Today, we are diving deep into the world of food allergies, where a simple meal can actually trigger a full-on battle inside your own body. You eat something and you just feel awful. But is it just a run-of-the-mill upset stomach, or is it something way, way more serious? That question is really at the heart of understanding food allergies, and honestly, getting the answer right can literally save a life. So let's kick things off with the most important distinction of all. We have to get our definition straight, because it turns out not every bad reaction you have to food is a true allergy. Not even close. Okay, that sounds a little technical, but the key phrase here, the one you really need to remember, is immune-mediated. That is what separates a true allergy from everything else. It means your immune system, your body's own defense force, has mistakenly flagged a harmless food protein as a dangerous invader and is launching an attack. This isn't just a digestive problem. It's a classic case of friendly fire. And this comparison just makes the difference crystal clear. An allergy involves the immune system, period. It can be life-threatening from even a microscopic amount of food. It is a completely different beast than a food intolerance, like, say, lactose intolerance. That might make you feel pretty miserable, sure, but it is not an immune attack, and it's not going to kill you. So how does this crazy immune mix-up actually happen in the first place? Let's get into the weeds a bit and break down the biology of this massive overreaction. Normally our gut is trained from the moment we're born to recognize food as safe. It's a state called oral tolerance. A food allergy is, at its core, a complete failure of this system. The immune system basically just forgets all its training and starts treating something harmless, like a peanut protein, like it's a deadly virus it needs to destroy at all costs. Now, this doesn't just happen overnight. It's a whole process called sensitization. First, that oral tolerance fails. Then, certain immune cells, these Th2 cells, they get the completely wrong message. They kickstart the production of special allergy antibodies called IgE. These IgE antibodies then go and attach themselves to other cells, called mast cells, basically arming them like millions of tiny little grenades just waiting for the trigger. The body is now fully primed for an attack. And here comes the explosion. The very next time that food is eaten, the protein in it connects with those IgE antibodies on the mast cells. This is the trigger that makes the mast cells degranulate, which is just a sciencey way of saying they explode, releasing this massive flood of chemicals like histamine that cause all the classic allergy symptoms. We're talking hives, swelling, wheezing, and it happens fast. But, not all allergies follow that immediate explosive path. There are really two main types. The one we just talked about is IgE-mediated. It's fast and it's furious. But there's also a non-IgE-mediated type. This one's a much slower T-cell-driven reaction that can take hours or even days to show up. It often presents with gastrointestinal symptoms, like in a condition called FPIES, which can cause some really severe vomiting and shock. So, with these different ways the body can attack, how do doctors figure out what's actually going on? Well, it's less of a test and more of a clinical investigation. It's like a detective story to find the real trigger. This right here is the guiding principle for any diagnosis, and it's so important to get this. No single test can give you a definitive answer. A solid diagnosis is like a three-legged stool. You absolutely need the patient's story. You need tests that show the immune system is sensitized, and sometimes you need a direct, medically supervised food challenge to really know for sure. And these are the main tools in that detective's toolkit. Now, this is a really, really important point for any exam. Skin prick tests and blood tests, they just look for that IgE antibody. A positive result only proves sensitization. All it means is your immune system has created the antibody. It doesn't actually guarantee you'll have a reaction when you eat the food. For that, we often need to go a step further. And this is where diagnostics get super precise. Component testing lets us break down an allergen, like a peanut, into its individual proteins. So, being allergic to a protein called RAH2, for example, points to a really high risk of a severe systemic reaction. But being allergic to another one, RAH8, might just mean you get an itchy mouth because of cross-reactivity with tree pollen. I mean, this is a total game changer for predicting a person's risk. But the ultimate test, the absolute gold standard, is the oral food challenge. This is where, in a totally controlled and safe medical setting, the patient is given tiny, slowly increasing amounts of the suspected food. It is the only way to prove 100% whether that food actually causes a reaction or not.
So, once a diagnosis is confirmed, the whole focus shifts from the what to the how. How do you navigate a world that's just full of potential triggers? It really becomes about managing this constant, invisible threat in your daily life. And let me tell you, that carries a real psychological weight.
This is it. This is arguably the single most important message for anyone with a severe food allergy or anyone who knows someone with one. Anaphylaxis, that severe, whole-body, life-threatening reaction, is treated with one thing: epinephrine, period. And it has to be given immediately. It is the first-line, life-saving medication, no question.
So, for long-term management, day-to-day life really revolves around these four cornerstones. It takes constant vigilance. We're talking reading every single label, asking super detailed questions at restaurants, teaching your friends and family what to do, and always, always, always having that epinephrine autoinjector ready to go. It's a huge mental load, for sure, but it is absolutely essential for safety.
But you know what? Strict avoidance isn't the only option on the table anymore. Oral immunotherapy, or OIT, is an emerging treatment that's really exciting. Under very strict medical supervision, patients consume tiny, gradually increasing amounts of their allergen to try and desensitize their immune system. It's a major commitment, no doubt. It often involves daily doses and regular clinic visits over a long time. And it's critical to know this is a treatment, not a cure. You have to keep eating the food to maintain the effect. But it can provide a life-changing safety buffer against a dangerous accidental exposure. All right, let's take all this knowledge and put it into practice. We're going to run through a quick clinical case. You know, the kind of scenario you might see on an exam, just to tie all these concepts together and see how they work in the real world. So think about it. You've got a kid with a history of eczema, which we know is a risk factor. They have a very, very rapid reaction on their first known time eating the food. What is going on here immunologically? What's your top diagnosis? If you said a classic IgE-mediated reaction, you are spot on. The super fast onset of hives and wheezing, those are the hallmarks. And that history of eczema is a huge clue that they were likely already sensitized through their broken skin barrier long before they ever actually ate the peanut. Their mast cells were already armed and waiting for this exact moment.
Okay, let's take it a step further. We run that component diagnostic test we talked about, and boom, it comes back positive for this specific protein, ARA-H2. What does that tell us about their future? This is a perfect example of the power of modern diagnostics. A positive ARA-H2 test tells us this is very, very likely a true, persistent peanut allergy with a high risk of severe systemic reactions. This helps us counsel the family on just how serious this is and why strict avoidance and always carrying epinephrine is absolutely non-negotiable. And that really brings us to our final thought for today. For decades, the entire story of food allergies has been one of avoidance, of just managing risk. But with treatments like oral immunotherapy really gaining ground, we have to ask the question, are we on the cusp of being able to truly retrain a faulty immune system? Or are we just going to be managing the risk forever? That is the question that's driving the entire future of this field.